Okay, here we go. So my name is Meredith. I don't know all of you. I'm a pelvic health physical therapist, and what we're going to talk about tonight is leaking and primarily urinary leaking. So leaking urine, which can happen, it happens a lot to people after babies, but it also can happen to people who've never had babies. We're also going to talk about urinary urgency and frequency and kind of just needing to go to the bathroom more than you think you should. And some other things to avoid to help prevent these things from happening. And then also some tips and tricks if you're experiencing any of these things to try to help resolve it. So the first thing, and if you have any questions, we'll just save them to the end and we can type them in the chat. Or if you have a question that like pops up in your head, you can type it in the chat whenever it comes in, but then we'll just wait till the end to answer. So the brain and bladder connection. So when we think about the connection between the brain and the bladder, our bladder has receptors in it that allow, the bladder is a muscle, so it allows the bladder to stretch and fill over a period of time. And generally it fills about 250 milliliters in a 2 to 4 hour time frame. And so as it stretches and fills, those receptors get activated. The receptors send a message to the brain and spinal cord saying, hey, we got to pee, we're stretched out, we need to go empty the bladder. And when you get that urge, oftentimes it can be, sometimes it starts mild, and that might be as that bladder is really starting to stretch, and then it gets stronger and stronger the more that you wait. But the thing that people complain about a lot is like getting a really strong urge, even though they just went. And so that's kind of that urgency of the urge is super strong, even though it doesn't necessarily make sense with the timing of when you went to the bathroom. And so, the brain bladder connection is really just that stretch and that sending that message that we need to go. So ideally, your bladder will stretch fully and fill up that 250 milliliters. And then it'll say, okay, now it's a strong urge. You have to go to the bathroom. You go to the bathroom and you empty. If you're the kind of person who claims to have a weak bladder, or you're like, I just go all day long, everybody in my family knows that I'm the one who has to pee, I'm always the one that has to stop. If you're that person, what's happening to your bladder? So most likely what's happening is that you're not allowing, and your bladder is not allowing for it to fill all the way. So it's kind of like an extra sensitive system. So it gets full just a little bit, and your brain is getting that signal, oh my gosh, we have to go so bad. It's a strong urge. We're completely full. We have to go. And so people will claim to have a weak bladder, but oftentimes it's not necessarily a weak bladder. It's an oversensitive bladder. So that sensitivity of those receptors is just really, really active. And so why does that happen? Well, a lot of us go, we call it just in case peeing, and you'll see this is on my list of things to avoid. So just in case peeing is what we're taught as little kids, where our mom says, Meredith, we're about to leave. We have to go to the bathroom. And like they tell you to go to the bathroom because you're about to get in the car and they don't want you to have to stop as soon as you get in the car, which cool, like good moms do that. It's not anything necessarily wrong. But if you don't have that strong urge and you empty when your bladder is just a little bit full, then your bladder learns that that little bit of full is time to empty. And so that brain bladder connection can get confused. And ultimately what happens is anytime you're that little bit full, you feel like you have to go. So it just continues to raise that sensitivity of those receptors. And therefore you feel like you need to go, even though you probably don't need to go yet. So lots of things that we can do to help with that. The biggest thing is avoiding just in case peeing. So just in case peeing, again, is just going just in case before you leave. If you see it, like I have friends who like see a bathroom and they're like, well, I might as well, I'm here already. And it's like, okay, well, we shouldn't do that. We should have a relatively strong urge to go before we need to go. And I think as women, we get a lot of, like when you're a teenager, you're told like, make sure you don't hold it too long, you get a urinary tract infection. And that's true. We don't want to hold it forever, but our bladders often can hold a lot more than we think. If you go to my YouTube or my Instagram, there's a cool video of me pouring in 250 milliliters and it's just over 2 cups of water. So it's a lot of water. So our bladders are capable of holding more than we often think. So just assess, that's what I always tell people. When you have to go, take a deep breath, because that helps calm the nervous system. Like McCartney was talking about, if we're too ramped up, we're like, oh my God, I have to pee. Then of course you're going to pee your pants because you're just freaking out. So take a breath, wait a second, and assess your body and say, is it really a strong urge, or is it just because my receptors are really sensitive? Can I hold it for a little bit longer? So that's kind of the brain bladder connection. We're going to go more into things to avoid later, but we'll keep moving with the bladder pelvic floor connection. So I'm going to grab try to not to knock anything over. Okay, so here's my here's my pelvis. I've got all my cute little organs in here. But this is the pelvis. We've got the lumbar spine in the back, sacrum in the back, pubic bone in the front, the ilium on either side, and then everything red that you see, sorry, it's backwards, so it's hard to tell. Everything red that you see in here is pelvic floor musculature. So that is what we're talking about when we say pelvic floor muscles. They're just a group of muscles that lay in the bottom of the pelvic floor. This is all pelvic floor muscles. We have 3 layers of them, and they are the pelvic floor. And then this little one is your bladder. And so the bladder and the pelvic floor have an opposite relationship, meaning that if you are on a road trip and you can't go pee yet, your pelvic floor will be contracted slightly to hold everything in. And your bladder, because again, it's a muscle, is relaxing and filling. It's doing that relax and fill. And it's filling enough until those receptors get activated, and it tells the brain you have to go. So pelvic floor is on, bladder is off because it's filling. Then when you safely make your way to the bathroom, you sit down on the toilet and you relax, and your pelvic floor relaxes and opens, and your bladder contracts and pushes the pee out. So that is the relationship between the pelvic floor in the bladder. So they're opposite. If one is turned on, then the other one is turned off. And so the thing that can get really confusing for people with their pelvic floor and bladder connection is sometimes we're real interesting as humans, and we're like, I can't sit on that toilet, it's so disgusting. And so we hover, and we hover over a toilet, and we don't sit down. And so if you're hovering, your pelvic floor has to be on because it's holding you upright. And then now you're asking your bladder to also turn on and push the pee out, and you're kind of pushing out of a closed door. And so now you've completely confused the system because they should be opposite. If one's on, the other one's off. So if you pee while you're standing in the shower, that can contribute to leakage because your pelvic floor and your bladder are basically learning that they can both be on at the same time, which is very confusing for the system. If you hover, that can cause your pelvic floor and bladder to be on at the same time. So we need to sit fully down, and there's lots of ways to keep it clean. We can use the little covers, we can wipe, we can make it work, but we have to fully sit down or else the pelvic floor will be on and you're peeing through those closed doors. And so then all of a sudden you're at the grocery store and you sneeze, and your bladder and pelvic floor are like, well, we pee standing up in the shower, so I guess it's fine here, because they don't know you're in the grocery store, and then you have leakage. So it's just really important to keep these relationships consistent. Our bodies and brains are super smart, but they can also get really confused if we are sending them mixed messaging. So if the other thing that I see a lot is power peeing, and I see moms do this a lot because they're in a hurry, because they're like, oh my God, I don't want the baby to fall off the bed. I left her there for a second, and they push the pee out as hard as they can. And that is also confusing for the pelvic floor, because if you feel like you're pushing, your pelvic floor is not relaxing. So what should happen when you sit on the toilet to pee is you should just sit and relax and enjoy your 5 seconds of quiet. And you should let your pelvic floor open, and your bladder should push the pee out. You shouldn't have to do any pushing, any straining. That's true with pooing too, which we'll talk about in a different talk, but peeing shouldn't be something that you're pushing out. It should be your bladder just contracting and emptying. That's what your bladder is designed to do. So The other thing on the things to avoid list that is related to the breathing and pelvic floor connect, or the bladder and pelvic floor connection, is the Kegels on the toilet. So you'll hear a lot of people say, you know, you can do a Kegel if you can stop the flow of urination. And that is accurate in the sense that if you turn on your pelvic floor because of that opposite relationship, your bladder will turn off and it will stop the flow of urination. And that's great to know that you know how to do that. But if you practice that like every day or once a month, even just regularly, then your bladder and your pelvic floor are like, what the heck? I thought we were supposed to relax on the toilet. And now she's making me contract on the toilet. And it just, again, confuses that messaging. And so we want to be super clear with our bladder and our pelvic floor and our brain to say, when we're standing up, we want the pelvic floor to be on, bladder to be relaxed and filling. When we're exercising, when we're sneezing, we're coughing, laughing, screaming, all these things. But when we sit on the toilet, we want it to be relaxed pelvic floor and bladder contracting and emptying. So avoid kegeling on the toilet, avoid hovering, avoid power peeing, and avoid just in case urinating. Make sure that you have a strong urge before you decide to go to the bathroom. So now I know I'm talking about a lot of stuff. So if you guys are like, what? If you have a question, I'm just gonna pop in here real quick and see. Okay, so I have seen a lot of the gals in my pregnancy group saying, remember to do Kegels on the toilet. Yes. There's so many things wrong with that in the sense that they shouldn't be doing 1 million Kegels a day anyway, but also they doing it on the toilet again just confuses that connection. And the reason that I say that people shouldn't be doing 1 million Kegels a day is because, and we talked about this in my last talk if you were there, but all muscles can be really short or really long or kind of right in the middle. So if you think about my biceps, we can be all the way short, all the way long, or right in the middle. And our muscles have what's called a length tension relationship. And it's basically where the little sarcomeres and everything attach, kind of like a train track. And depending on where the muscle is in that length tension relationship, it's stronger in certain positions. So if I tried to carry a box like way up here, that would be hard. If I tried to carry it with my arms straight, that would be hard. But if I carried it here, it would be easier. So ultimately, the pelvic floor also has that relationship. It's going to be stronger in certain positions. And if you Kegel all day and you never learn how to fully relax it, it would be like if I did this with my bicep all day with a heavy box and I never learned how to straighten my arm. That can also contribute to leaking. It can contribute to prolapse. It can contribute to all the stuff that we normally associate with kind of a weak, loose pelvic floor. The same things can happen with a tight pelvic floor, because in order for the pelvic floor to be happy, healthy, be able to contract and relax and hold everything in, we need it to be able to fully contract and fully relax. And so what we see a lot of times with people who are Kegeling on the toilet, people who are just Kegeling for fun all day long, they tend to have too much tension, and that can contribute to all these same issues. So Kegels are not inherently bad, but they have to be done correctly, and they have to be done with more relaxation than contraction. You wouldn't just be like lifting with your biceps all day long. You know, you don't do that with any other muscle. You also let your arm be straight after you lift with your biceps. So it's just making sure that we're getting that full excursion of both contract and relax. And that's what a lot of people aren't doing. Also, if we look at the research, if you just give someone a handout and say, this is how you do a Kegel, stop the flow of urination, about 90% of people are doing them incorrectly. Therefore, a lot of times they're actually pushing out. They're not lifting up and in. And so that is kind of a reverse Kegel or a bulge, which can contribute to a lot of other issues. So I don't encourage Kegels unless someone has had some sort of feedback and assessment of if they're doing it correctly, because it can really contribute to a lot of issues that we just don't want to have. So that's my little Kegel speech. But, you know, I think it's a common thing. And it's really interesting because you'll hear a lot of older women too say, well, I did all my Kegels all those years and it didn't seem to help. And it's because it doesn't, because that might not have been what they needed. It would be like if you went to the personal trainer and they told you that everyone needs upper trap strengthening or bicep strengthening. It's like, not everyone could need exactly the same thing. So it's just that same thing. We all need different things. And so getting an assessment is truly the best way to figure that out. But I'll get off my soapbox. I get very worked up about that one. So urinary urgency. So urgency, again, is that really, really intense urge to go to the bathroom, even though it might not make sense with how much fluid you've had or how much water intake you've had. So there are a couple things that can contribute to that. One of them is the 4 C's. So bladder irritants, which are caffeine, carbonation, cocktails is really just any type of alcohol, and then citrus. And a lot of times people find that they also have other bladder irritants. Just personally, they'll recognize things that make them feel like they have to go pee more. And, you know, we can't avoid caffeine, carbonation, cocktails. So it's not necessarily that we need to avoid these things. It's just that we need to be aware of how they affect our bladder and also incorporate more water with them. So hopping down to this point here, water is your friend. So a lot of times people will say, well, I'm leaking all day long and you want me to drink more water? Like, that doesn't make any sense. But it actually does, because water can dilute any of these triggers that you have, the things that make you more likely to. So say coffee makes you feel like you have to pee really bad. If you have a glass of water either before or after your coffee, that's going to dilute the coffee that goes into the bladder, and then it's going to be less irritating to the bladder. Same thing with alcohol, same thing with a citrus, like a juice, carbonated drink, anything that makes you feel like you really have to pee, having just a plain glass of water with it can help with those symptoms. And then also, you know, water is your friend because it can help you reestablish that stretch and allow your body and your bladder to get that full stretch before those receptors go off. So over time, and it takes a week or two for people to increase their water intake and then let the bladder get used to a stretch. And so when we talk about the numbers, we're kind of giving averages because, you know, everybody's a little different. Like, some of my folks drink so much water, so they're going more frequently. But just general guidelines, we want to pee about 5 to 7 times a day during the day while we're awake, and then about 1 to 2 times per night. So with a healthy person who's not having any significant bladder issues, 1 time a night or 0 times a night would probably be recommended. As we get older, sometimes we do have to go more frequently. So 2 times a night is still within the normal range. And then we also want to pee every 2 to 4 hours. So the way to kind of work on getting those bladder receptors to stretch more is to slowly increase your water intake, and then also to look at how often you go to the bathroom. So scheduling a bathroom break, you know, every 2 to 4 hours. Still keeping in mind that we don't want to go unless we have the strong urge, but just, you know, making sure you have the time to, because I think a lot of times with incontinence, people, you know, it's like they have incontinence and then they wait until it's really intense, strong urge, and then they can't make it to the bathroom. And when we have an accident like that, we don't make it to the bathroom in time, that continues to feed that mixed messaging. So we'll talk a little bit about how you can make it to the bathroom safely, but it's just important to know that over time you can increase your bladder capacity, even if you have, you know, quote unquote, weak bladder. It's really just that your bladder receptors are more sensitive. So let's see where we are. So that's urinary urgency. Frequency goes hand in hand with that because frequency just means that you're going really, really frequently. So if that's the case, again, it's probably that you're just in case peeing. You're probably not allowing those bladder receptors to stretch. But be patient with it because it doesn't just happen. Like you can't get those bladder receptors to stretch overnight. It's kind of like if you are trying to work on your flexibility, it doesn't just happen overnight. But with consistent practice of, okay, I go to the bathroom every 2 to 4 hours, I'm drinking X amount of water. And general guidelines for drinking water is about half your body weight in ounces. And, that really depends on your exercise, where you live. We used to live in Arizona, and I drank way more than that in Arizona because it's really dry. So, there's some factors there, but generally, that's a good amount of water to have. And they've done some recent research into like my favorite drink, the LaCroix. It's interesting because they'll say that it truly is just water and then it's not a bladder irritant, but it does have carbonation. So it can be a bladder irritant for people. And so I strive to always have a glass of plain water with a LaCroix. So just doing those kind of things can really, really help. And you can still enjoy your cocktail. You can still enjoy your citrus, whatever it is that you like. You're just adding some extra water to dilute that so it's not aggravating the bladder. So stress urinary incontinence is when we have leakage with some sort of stress to the system. So stress can be jumping, it can be laughing, it can be coughing, it can be sneezing. So our pelvic floor muscles can work in a lot of different ways. One of the ways that they work is with a long kind of endurance hold. So throughout the day, as your bladder is filling, your pelvic floor is on very gently, not anything crazy, not a big contraction, but it's just kind of hanging there. It's turned on to keep everything in. And the other component that the pelvic floor can do is like a quick contraction. So when you sneeze, your pelvic floor will do a quick contraction in order to keep pee in and not allow you to leak. And so what we see a lot of times, especially early postpartum, and in just people that have high levels of activity, lots of different reasons why people can have stress urinary incontinence. But they'll have leakage when they sneeze, when they cough, when they laugh, when they scream at their children, when they exercise. And so there's, again, a lot of reasons, trampoline, exactly, a lot of reasons why that can happen. And what tends to happen is people will say, well, I just can't jump on the trampoline. That's just I'm past that point in my life. But the good news is we can also train those muscles. So we can train the pelvic floor to do a slow contraction and a full relaxation, which is a lot of what we do to help with pain and with a lot of different things in pelvic floor therapy. But we can also train that quick contraction and that kind of reactive ability of the pelvic floor. And a lot of that is, getting the muscles around the area to work better, but it's also kind of learning how to do a quick contraction. The biggest thing that I find with people who try to do a quick contraction, they can do like 1 or 2, but then it starts to get really kind of all over the place and hard to coordinate. So we can teach people what we call the knack, which is basically just do a quick pelvic floor contraction before you sneeze. We don't always know when we're going to sneeze, but if you know it's coming, or before you cough, or before you raise your voice, or stomp your foot, or whatever it is that causes that. And that's a great way to stop it in the short term. That's not going to work every time because sometimes, you just sneeze out of nowhere. And sometimes, like when you're on a trampoline, that would never work. You can't just be contracting that quickly. So we can also train people to do things like practice getting their pelvic floor to be more reactive by challenging them on a trampoline, getting them to understand really how to contract and relax the pelvic floor. I also do all kinds of cool things with my clients where I have them in a plank and I have them like do the toe taps out to the side, but I have them like stomp their foot into the ground. because that is that reactive ability of the pelvic floor to feel that, oh, it feels like we're going to leak, and then it comes on. So it's almost an anticipatory reaction that the pelvic floor has, and that is only trained by doing balance exercises, by really training that component of the pelvic floor. Generally, what I find clinically is that if I can get someone to do a full contraction and do a full relaxation and restore that first, then we can work on that quick endurance, and everything improves. But if you don't know how to do a Kegel because you've just read about it and you've never been taught by a professional, then it can be very confusing because it can be hard to know, am I doing it correctly? Am I breathing correctly? So I want to take you guys through a little kind of tutorial, and it's going to touch back on this breathing and pelvic floor connection. So I want everybody to put their one hand on their belly, one hand on their chest. And first, I just want you to breathe for me and see what you feel. A lot of us have had training to teach us about belly breathing. So we're tempted to want to put more air into the belly, and that's good. But now what I want you to do is see if you can take your hand that was on your chest, and I want you to just kind of set it on your crotch, and nobody can see you, so you don't have to worry about that. And I want you to breathe in and see, as you breathe in, what should happen is your diaphragm, which is your breathing muscle underneath your rib cage, and your pelvic floor muscles, that hammock and the pelvis, should all descend as you breathe in. And then as you exhale, they should all gently rise up away from your hand. And so just take a few breaths for me and see if you feel that. And it's super subtle, so it's not going to be like punching you in the hand or anything. It's going to be really, really gentle. And if you can't feel it with your hands, sometimes if you sit on a towel roll, like you're riding a horse, you can feel that a little bit better. But what happens sometimes is that when we do something like sneeze or laugh or cough or exercise, sometimes we hold our breath because we're, anticipating it to be a challenging movement, or we're afraid we're going to pee our pants or whatever it is. We'll hold our breath, and what that does is it puts all the pressure that's in the abdomen, all that air, kind of stuck, and it has to go somewhere. So if it can't go out your mouth because you're not breathing out, it's going to go down into your pelvic floor. And that can also contribute to leaking, symptoms of heaviness, pressure, all kinds of funky things. So one of my biggest pieces of advice for people is to get comfy with breathing and feeling movement in your pelvic floor, because that's the first step in connecting with your pelvic floor. So just sitting there, breathing in, feeling your pelvic floor descend, feeling your belly rise, and then exhale, feeling your pelvic floor gently lift. And you don't have to do a contraction, just think about a gentle lift, and it will naturally lift on its own, because that's how the diaphragm and the pelvic floor work together. And then your belly will just come in a little bit closer to you. And so that would be step one. And then the other component of it with leaking is that when we're really ramped up, when we're really nervous or we're feeling anxious, our breathing tends to increase, and we just stop breathing. And that can also contribute to leaking, because our nervous system is so ramped up that we leak because our bladder receptors are more sensitive. There's a number of reasons why. And so if you feel really intense urgency, if you feel like you're going to pee your pants, doing just a deep breath, a deep diaphragmatic breath, like that can really help kind of reset everything, bring you back down, and help you safely get to the bathroom before having an accident. Obviously, jumping on a trampoline, sometimes that is just that quick endurance muscle, and we just need to train that in a different way. But especially when we're talking about urgency, or just feeling like you're not going to make it to the bathroom and you start to get really stressed, I talk a lot on my Instagram about things like triggers. So sometimes people will pee their pants like as soon as they pull into their driveway. They're like, are you kidding me? I was literally almost there. And it's because that your brain has recognized this spot as like, okay, I'm home, I can pee now, I can relax. And or you put the key in the door and that causes you to pee, or you're about to take your dog on a walk, you're like, well, I should just pee once more before I leave in case I have to pee on a walk. So again, all these things are really interconnected and they contribute to leakage and urgency and all these things. So if you feel the big urge to pee, you can take a deep breath. And I always like to have people stop where they're at, because if you're moving, it gets confusing for your body. So just stop where you are, take a deep breath. And then what you can do is what we call an urge drill. So that is in my little tips and tricks here. So what you can do is, again, the pelvic floor and the bladder have that opposite relationship. So if your pelvic floor is contracting, your bladder is relaxing and filling. So you can do 5 quick pelvic floor contractions, and then your bladder should start to relax a little bit more, because just naturally it's going to be inhibited by the fact that the pelvic floor is turning on, and your urge should go down. The chart, when we look at the chart, it's kind of like, okay, I have a really strong urge, and then I do my 5 pelvic floor contractions and my breathing, and then it goes down. It's going to come right back up because your bladder receptors are like, hello, I told you we have to go to the bathroom. So it's going to come back up. You're going to do 5, you're going to do another deep breath, 5 more pelvic floor contractions. It's going to go back down. It's going to come back up. And you're basically going to do that till you safely get to the bathroom. But I truthfully have people stop where they are. So they might be like 5 feet from the bathroom. They're like super close. And the temptation is to just like run and like hope you make it. But we have to retrain these messages. So you have to stop, breathe, do your 5 pelvic floor contractions. Urge decreases, you start walking again. And again, we're calmly walking. We're not like racing there. Again, and you just keep doing it until you safely get to the bathroom. And then the most important part, and this is the part that people struggle with, because as soon as they get on that toilet, they just want to like, and they want to let go and they want to pee, of course. But I don't know how many of you have children, but it's kind of like when you have a little kid at the grocery store and the little kid's like, Mom, I really want this candy bar. Can I please have it? Daddy said I could have, they like try to use the other parents. Somebody said I could have it. I've been so good today. And they're just begging and begging. And you don't want to buy the kid the candy bar because, whatever reason. The more the likelihood of them continuing to do this behavior is going to go up if you give in and give them the candy bar. And it's the same thing with the bladder. So if every time we buy the kid the candy bar, if every time we get to the toilet and we're like, oh, okay, and we pee, then the bladder is continuing to be in control. And so what I like to have people do is I like them to get to the toilet. I like them to sit and get comfy and relax. And then I like them to literally tell their bladder it's time to pee. So, okay, bladder, you now have permission to pee. And it seems silly, but again, if your brain bladder connection is so mixed up in messaging that every time your bladder feels full and you feel like you have to pee, you wet your pants, you have to reestablish that control of your bladder in order for that message to change. So it's literally kind of taking control of your bladder and reminding it that, no, you really don't have to pee. I get a lot of people who will tell me things like, well, I like lay down at night and I already peed, like I brushed my teeth, I peed, I flossed or whatever. And then I lay down in bed and all of a sudden it's like I have to pee again. And I'm like, I literally just went, there's no reason I have to pee. And things that I'll have them do is they can do the urge drills, but they can also just do some deep breathing. And it's really remarkable how just resetting that deep breathing and also telling your bladder, you don't have to pee, we just peed, it's okay. And kind of giving your bladder a little pep talk can really, really work. And a lot of it is just resetting those connections and those communications because something has gotten off in the wiring. And the reason that we see it a lot with postpartum people is because, there was a baby sitting on your bladder for a long time. And so, in just this space occupying situation can cause more urgency, more frequency, and all of that. And so sometimes our bladder, the receptors just get so sensitized during pregnancy that after baby is born, we continue to have that urgency and frequency. But if we can kind of regain control of that relationship, we can really make a big difference for people, because after baby, you shouldn't have to be peeing 1,000,000 times a day. But it does take a little bit of time, and it does take some specific practice. So let me make sure I don't have anything else that I want to cover. Those are the big things. So I'd love to open it up for some questions. And literally nothing is off limits. I'm a pelvic floor PT, so people ask me all the weird things. But feel free, you can direct message me in the chat, or you can say it to everybody in the chat. And I'll open up to any questions, and then we'll kind of see if there's anything else we want to chat about. But I appreciate you guys for showing up live. I know that it's hard sometimes to find time these days.
I have a question.
Yeah, go ahead.
So what I'm hearing you say is that it's more about a brain connection, a brain muscle connection to the pelvic floor than it is about just having, like, I don't know, weak pelvic floor muscles or stretched out. I guess my perception, like after having 3 kids, I always thought that, I don't know, the muscles just got, misformed or stretched out or something, but it's more about a wiring, like a connection.
So it can be both. So a lot of different things. I think the big myth about after a baby that the pelvic floor is stretched out is from the fact that when you birth a child vaginally, the pelvic floor does undergo the pelvic floor muscles undergo a significant stretch. And so that is true that they do get a big stretch. But oftentimes what we see is less of the fact that they're truly weak, more of the fact that they're either not turning on for some reason. So they can be not turning on because you have low back pain, or because you have hip pain or pelvic pain or pain with sex. All kinds of pain can inhibit the pelvic floor muscles because they're stabilizing muscles. So it could be just inhibition of those muscles. It can also be a lack of awareness of those muscles. So the reason we did the breathing exercise is because I really like people to connect with the pelvic floor and feel it, because a lot of times when I talk to women, or anybody really, they'll say, I just don't even know what you're talking about when you say like lift up on my finger, or, like that cueing just doesn't make any sense. And sometimes that lack of awareness can be related to trauma from a birth too. Sometimes we disassociate from areas of the body that we're just not happy with for whatever reason. So there can be a lot of reasons why a person doesn't demonstrate the strength that we would expect them to. And it's less about truly that the muscles are like so stretched out. It's more about the fact that there's a lack of awareness brain body wise. And that can be, like I said, for so many different reasons. So my goal number one is to, when I check a pelvic floor, is to check for awareness. Can they feel me touching them? Can they attempt to do a contraction? And then we also have to check for tension too. So again, like we talked about the biceps, sometimes people demonstrate weakness even though they've actually got a lot of tension in the muscles. So when we check the pelvic floor musculature, we check for tension. And it's really remarkable how we release tension, very similar to how you would in your upper trap. You just push on it and hold and breathe and relax. We do the same thing internally with the pelvic floor muscles. And pretty quickly, people will have a significantly stronger contraction because they're able to use the muscle more efficiently. So it can be because of lack of awareness. It can be because of true lack of strength. Some people really truly do have lack of strength, but I clinically see a lot of pelvic floors, And I will say that the majority of them have a lack of awareness or a lack of connection to that area. And once I get them connected to that area, they actually are pretty strong. It's usually just that the timing of the contraction. So like they're not getting that quick contraction and that's why they're leaking, or they're not getting a full contraction because they're holding tension. So there can be a number of reasons why, but it's usually because there's some kind of disconnect. And once we get everything connected, brain and body and bladder, we can put all the pieces together. And most people are not truly weak. I treat 60, 70-year-olds who have been told you have no strength, you had 4 babies, you have no strength in your pelvic floor. And I get them connected to their pelvic floor and they have better strength than my 30-year-olds. So it's not necessarily a strength issue. Strength is activation, it's timing, it's coordination, it's endurance. It's not just like pure, can you do a Kegel? Does that make sense?
Yeah, it's really fascinating. Thank you.
Yeah. So I truly, obviously not everyone is going to be my patient, and that is not my goal with these talks. My goal is to educate, but I truly, truly believe that every person who has had a child needs to have a pelvic floor assessment. And it doesn't matter if you're 30, 40 years out of having your child. I just truly believe that that's the only way to figure out what's going on, because nothing is ever just the pelvic floor. So let me show you my model again. Take all these little guys out. When we look at these muscles, we're really looking at, these white guys are ligaments. We're looking at all these connections to the spine, and then our hip bone is down here. And so, it's just not true that we can treat the pelvic floor in isolation. When I'm treating internally, I'm also moving the hip and I'm checking the abdomen and I'm checking your breathing and I'm looking at your neck and your jaw and your feet and your thoracic spine. And so it's just not possible to tell you that, okay, you had 3 babies, you're probably super stretched out and that's why you leak. That doesn't make any sense, because we do see an anatomical change in women once they have a child. We see that the opening is just a little bit more open and maybe, it just looks a little bit different. But there's no evidence to show us that we're like looser, or that is a lot of myth that our society has taught us. That really doesn't make any sense, because the majority of women actually have too much tension in their pelvic floor because they're jaw clenchers, because they're chest breathers, because they're just super stressed out people. So when we carry tension in our jaw, we also carry tension in our pelvic floor. So it's just really not fair to us to say that we're all like a certain way for a certain reason. There's usually a lot of pieces of the puzzle, and I just really feel passionately that we have to look a little deeper to understand what's going on. These are basic mechanics that are true for everyone, but urinary incontinence is never just one thing. But my favorite thing about incontinence is that it's so stinking treatable. I have story after story of, 65-year-old woman has been leaking for 30 years, had a stimulator placed to have to stop bowel and bladder incontinence. So literally had a major surgery, had a lumbar fusion to see if that would help. Went to a pelvic PT that didn't do anything good for her. I saw her one time and I got her to poop correctly and breathe correctly, and she stopped leaking. So it's just one of those things where it's all connected and we really can't isolate. Oh, you just need more strength. Oh, you just need this. So that's why I think Instagram and YouTube and Facebook are great for some things, but getting a true individual assessment is the key to solving your issue, because it's super solvable. Okay, somebody asked, are the quick clinches the same as Kegels or a different mechanism? So they are the same contraction, They are just almost like pulses, like when you do like pulses in a class, it's kind of like that. So we have different types of muscle fibers. We have more like endurance fibers, which are slow twitch fibers, and then we have more quick response, fast twitch fibers. And every muscle has a combination of both. So like a lot of our muscles can work in both ways. And that's true with the pelvic floor too. So the pelvic floor can do a slow contract, relax. It can do kind of an endurance hold. That's what holds us up all day and supports us throughout the day. And then it can also do a quick contract, kind of anticipatory to prevent leaking with sneezing, coughing, jumping, that kind of stuff. So we just have to train them differently. And generally, if we can restore, good tone, good length, good contraction, good breath work, all those pieces, it'll all kind of come together. And yeah, so that's my answer. I'm like, am I done? Yes, I'm done. Does that make sense? But yeah, it's the same contraction. It's just a different mechanism of contraction. Cool. You're welcome. Any other burning questions? I'll see if there's any. I might do my cool little squatty potty talk real quick because I think it's really cool to see. And then I will keep us in our time. Okay, someone said, I'm wondering about how pelvic floor therapists can help with pain during sex. So I am going to do a specific talk about this at another time, about pain during sex. Like this talk was about leaking, and then we'll do another one. But pain with sex can be a number of things too. So it can be pelvic floor tension sometimes that the pelvic floor is not able to relax. So ultimately with pooping, peeing, sex, and delivering a baby are like the 4 big times that your pelvic floor should relax, and basically the doors should open. So you can kind of think about, so if this is my other little guy, so it's just a paper model, but this is external pelvic floor. So this is your vaginal opening, your anal opening, and then this is the inside, all the muscles. So you can think about those 4 times, sex, pooping, peeing, and baby, that this would have to relax and open the doors so that things can come in or out. And so with pain with sex, sometimes it's a matter of the pelvic floor muscles not being able to relax fully, which is kind of the opposite of a contraction. It's getting that full length and kind of letting the pelvic floor descend and open. There's a lot of reasons why people have difficulty relaxing. It can be because they've been doing Kegels their whole life, or it can be because they don't have good diaphragmatic movement. Maybe their diaphragm, like something's going on with their ribs because they had a baby. It can be the number one reason that I see with pain with sex is people are not using lube, which blows my mind. But I think lubrication is necessary for all sexual activity. Good lubrication is 1000% worth it, and it's not even that expensive. I will write in the chat here my favorite lubes, but Slippery Stuff is my favorite water-based lube, and Uber Lube is my favorite oil-based, or like silicone. It's silicone-based. Silicone-based lube. But there's all this, again, social media myth that we are just meant to be little natural lubricating machines. And that's not true, because, your ability to lubricate naturally is affected by so many things. How hydrated are you? How stressed are you? How into the situation are you? How are you breastfeeding? If you're breastfeeding, you're basically in a menopausal state. So you're not producing as much natural lubrication because of your estrogen levels. If you're menopausal, that can contribute. So everybody needs to be using lube all the time. It can be sexy. It doesn't have to be like, oh, wait, let me just squirt this on here. It can be like, you can make it more fun than that. And then CBD lube can be really helpful for pain with sex. And my favorite is Go Love CBD. It's a water-based, oops, I just sent that to a direct message, but I'll send it to everybody. But it's a water-based lube and it's just really, really great. Yeah, so relaxing pelvic floor during sex does not mean we shouldn't be tightening or doing Kegels during sex. So this is a very, very interesting question. We should be relaxing during sex to allow things to come in. Doing a Kegel during sex is not inherently bad, especially if it's giving the person pleasure or it's giving your partner pleasure. Some people, like if someone was having pain with sex, I would tell them definitely not to Kegel during sex because they really need to be working on that relaxing. But if you've never had pain with sex, if you're having happy, healthy pelvic floor, a couple Kegels during sex is not going to make anything wrong. When we naturally have an orgasm, our pelvic floor will contract and relax on its own. So it's going to do that during, if you're able to get to a climax. And so it's not necessarily inherently wrong to do that during sex, but continuously Kegeling or not breathing during sex, things like that can contribute to tension in the pelvic floor and issues. So I never like to say anything is inherently bad because there's a situation for everything, but just making sure that we're not Kegeling, especially if we're having pain. And also just looking at, and truthfully, if we think about how the pelvic floor works, if you are on top or if you are, whatever position you're probably going to have your pelvic floor turned on in those positions because you have to balance. So one of the things that I really get upset about is sometimes people will say after baby that you should be on top because then you can control the depth. And that is true if you're having pain with sex. But if you're on top, your pelvic floor has to be on to keep you from falling over. And so I actually prefer people after babies, if they're having pain with sex or if they're just having pain with sex in general, to try more of a side lying position because that's more relaxing for your pelvic floor. So I assess all of my patients' pelvic floors in different positions. I'll have them standing, I'll have them laying, I'll have them side lying so that we can see, because it's not the same for everybody, but just generally when we look at the big scheme of things, being on top is more of a tight turned on pelvic floor because it's helping you balance. Being on your side or laying on your back is a little bit more of a relaxed position. So, and side lying has been shown to be a really great birthing position and it can reduce tearing and things like that. So, it's just a nice position for the pelvic floor as long as your legs are supported. Because if your legs are too unsupported, then your pelvic floor will turn on too, but different topic. So yeah, Kegels during sex is not inherently bad. It's just not something I would recommend to anybody who's experiencing any kind of pelvic pain or any kind of pain with sex. And I would just use sparingly. But real quick on my 2 minutes. So if we look at the inside of the pelvic floor, all of these are muscles, but if you see this little red guy, he's the pubovaginalis. He wraps around the vaginal opening, and then the puborectalis wraps around the rectum, and it's the greenish one. And so the puborectalis, when it wraps around the rectum, it actually makes the rectum kind of look like this. And so your rectum is basically curved and your stool has to literally make a turn to get out. And so the reason we use the squatty potty is because if your hips are higher than your knees, you're in a more relaxed pelvic floor position and that puborectalis kind of loosens and your rectum goes straight. So the poo can just fall straight down with gravity. So same thing with peeing. There should be no straining or pushing with pooing. If you're in the right position, you've got your legs up on the squatty potty, you've got your elbows on your knees and you're just relaxing. You can do that diaphragmatic breathing, and that breath in of itself will use the pelvic floor and your diaphragm to move the poo out smoothly and not have to have any straining. Obviously, we also have to have good stool consistency for things to move that smoothly. So we want kind of a long sausage-like log, not little deer pellets and not like diarrhea. So somewhere in that middle range. But I just like people to understand why the squatty potty, because people are like, I don't like the squatty potty. It's all the rage, but I'm cooler than that or whatever. And it's like, it actually works. So there's an anatomical reason why we're doing this. So, and you don't have to have the squatty potty. You can have a kid's stool, you can have whatever. Yeah, people have a wood one. They make really cute ones. I just got one with a nightlight on it in our bathroom. So for the guest bathroom, so that people like don't fall over when they're trying to navigate the new bathroom. So lots of options on Amazon and other places for squatty potties. Any other big burning questions? We did great on time. I appreciate you guys hanging in there with me. Wonderful. So I'm planning on doing a talk like this once a month. We're going to cover different topics. This one was obviously leaking. We're going to cover, I'd love to do one on bowel incontinence too, because I think it's a really, really under discussed topic because people think poo's gross and they don't want to talk about it. So we'll talk about that one month. And then we're also going to do one on pain with sex. We're going to do one on prolapse. So pelvic organ prolapse. We'll do one, I'm trying to think of what else. There's so many topics we can cover: pelvic floor, interstitial cystitis, endometriosis. We can really, the list goes on and on, constipation. So just stay tuned. If you don't follow me on Instagram, I'm Dr. Meredith Brzezinski, PT. I post everything on there, and I also have an email list. So if you just message me, you can get on my email list to make sure you are up to date on when we're doing the talks. But I appreciate all of you, and I love chatting all things pelvic floor. So if you are just wanting to chat and if you have a question, if you're a local here in Portland and you're having an issue, I'd love to work with you. I treat all in home, so I come to you. There's no need to travel to a clinic or anything, and I'm fully vaccinated now, so I'm relatively as safe as can be. But I love treating all things pelvic floor, and I'm happy to chat with you one-on-one if that's something you're interested in. Awesome.